What is ankylosing spondylitis? Ankylosing spondylitis, AS, is a chronic inflammatory disease that primarily affects the spine and sacroiliac joints, where the spine connects to the pelvis. Over time, the inflammation can lead to the fusion of vertebrae, resulting in a rigid and less flexible spine. AS is a type of arthritis and belongs to a group of conditions known as spondyloarthritis. It can cause significant pain and stiffness, particularly in the back and neck, and may also affect other joints and organs. Causes of ankylosing spondylitis. The exact cause of AS is unknown, but it is believed to involve a combination of genetic and environmental factors. 1. Genetic factors. The HLA-B27 gene is strongly associated with AS. Not everyone with this gene develops the condition, but it significantly increases the risk. 2. Immune system. AS is thought to involve an autoimmune response, where the body mistakenly attacks its own tissues. 3. Environmental triggers. Infections or environmental factors may play a role in triggering the condition in genetically predisposed individuals. Symptoms of ankylosing spondylitis. Symptoms typically develop gradually and vary in severity. Common symptoms include 1. Pain and stiffness. Chronic back pain, particularly in the lower back and buttocks. Pain often worsens during rest or inactivity, e.g., at night or in the morning, and improves with exercise. 2. Limited mobility. Reduced flexibility in the spine, leading to a stooped posture in advanced cases. 3. Fatigue. Persistent tiredness due to inflammation and pain. 4. Peripheral joint pain. Inflammation in other joints such as the hips, shoulders, knees, or ribs. 5. Enthesitis. Inflammation where tendons or ligaments attach to bones, commonly at the heel, Achilles tendon, or bottom of the foot, plantar fascia. 6. Eye inflammation, uveitis. Red, painful, and sensitive eyes, often associated with blurry vision. 7. Other symptoms. In rare cases, AS can affect the heart, lungs, or gastrointestinal system. Diagnosis of ankylosing spondylitis. Diagnosing AS can be challenging, especially in its early stages. Common diagnostic methods include 1. Medical history and physical exam. Assessment of symptoms, family history, and physical tests for flexibility and pain. 2. Imaging tests. X-rays show changes in the sacroiliac joints or spine. MRI detects early signs of inflammation and damage before they appear on X-rays. 3. Blood tests. Testing for the presence of the HLA-B27 gene. Markers of inflammation, such as C-reactive protein, CRP, or erythrocyte sedimentation rate, ESR. Treatment for ankylosing spondylitis. While there is no cure for AS, treatments focus on managing symptoms, slowing disease progression, and improving quality of life. 1. Medications. Nonsteroidal anti-inflammatory drugs, NSAIDs, reduce pain and inflammation, e.g., ibuprofen, naproxen. Biologic agents, TNF or IL-17 inhibitors, target specific inflammatory pathways, e.g., etanercept, adalimumab, secukinumab. Corticosteroids, short-term relief during severe flare-ups. Disease-modifying antirheumatic drugs, DMARDs, for peripheral joint involvement. 2. Physical therapy. Improves posture, spinal flexibility, and overall strength through exercises. 3. Exercise. Regular stretching and low-impact activities like swimming or yoga help maintain mobility. 4. Lifestyle changes. Maintain good posture and avoid prolonged periods of inactivity. Stop smoking to reduce the risk of complications. 5. Surgery. Rarely needed but may be recommended for severe joint damage or spinal deformities. Complications of ankylosing spondylitis. 1. Spinal fusion. Stiff and rigid spine due to the fusion of vertebrae, limiting mobility. 2. Kyphosis. Severe forward curvature of the spine. 3. Fractures. Osteoporosis in the spine increases the risk of fractures. 4. Organ involvement. Inflammation may affect the eyes, uveitis, heart, aortitis, or lungs, reduced lung capacity. 5. Chronic pain. Long-term inflammation can lead to persistent pain and disability. Prognosis and outlook. With early diagnosis and appropriate treatment, many people with AS can lead active, productive lives. Regular monitoring and adherence to treatment can significantly reduce complications and improve long-term outcomes. If you experience persistent back pain or stiffness, particularly if it improves with activity, consult a healthcare provider to rule out ankylosing spondylitis.